I'd like to now turn the conversation over to those who are living the realities and doing the work. And I'd like to invite Ellen MacInnis. You now have the floor. You have 5 minutes for your opening remarks. And you may want
Thank you, Tammy here. Thank you so much. Thank you to all of you who are doing that hard work on the Committee for Workplace Development. My name is Ellen MacInnis. I'm a registered nurse. I live in Boston, and I work in the emergency department at St. Elizabeth's Medical Center. I submit this testimony to you in support of occupational presumption resolution pending before this committee. All frontline workers across all the different industries supporting our society and our patients during this time have been exposed to COVID-19 as a result of their work and conditions associated with their work. However, I'm going to focus my testimony on the healthcare sector, my personal experiences as an emergency department nurse right here in Boston, and the experiences related to me by nurses and healthcare workers across the Commonwealth. We entered this pandemic unprepared. We can debate the hows and whys and how that came to be. And that's certainly outside the scope of this setting. But what we do know is that we did not have enough PPE, personal protective equipment. We did not, hospitals did not properly isolate and segregate patients. And the hospitals have not done a good job of tracing patients and the disease through the patient population. In some cases, the hospitals actively lobbied to lower the CDC infectious disease standards. Most importantly, the standards for personal protective equipment. This left frontline workers like me vulnerable. We weren't given appropriate N95 masks, and when we were able to get one, we were told we had to use it. Currently, the procedure at St. Elizabeth's is a nurse is required to reprocess an N95 mask up to 10 times. So that's over 120 hours of use of breathing into the same device. And I'd like you all to note that none of the manufacturers of these masks have signed off on any of the cleaning processes that are being used. These masks are only supposed to be single use. The hospitals have delayed implementing directives that all employees should wear masks and segregate patients. That was early on. We were told, don't wear masks, it frightens patients. Well, we now know that that's when a lot of people got infected. As all this was going on, the governor made this dramatic stay-at-home order and said there shouldn't be more than 10 people gathering. And yet the Boston hospitals kept putting nurses and other healthcare workers on these shuttle buses and shuttling them in from parking lots miles away. And mind you, these buses pulled up to disperse patients in front of empty garages. We at St. Elizabeth's asked management, since we don't have any visitors and you're on a skeleton workforce, can our nurses and nursing assistants and cleaners and people like that park in the garage? And no, the answer was no, we've never gotten to do that. But for the efforts of Representative Honan, who got us spaces down at Mount St. Joseph, and the mayor, who got us 75 spaces at Brighton High, you would still have 15 or 20 people crammed onto these buses. And actually, I think we submitted a photo of one of those crowded buses to the council. Meanwhile, we started to hear from the hospitals that if you work for the hospital and you became sick, that more than likely you acquired that sickness out in the community. My very dear friend became COVID positive, and her experience is personally related to me, is that of many, many other people. when the tracer from St. Elizabeth's called her, she asked her if she had been out of her house, done any of her own food shopping, gone into a coffee shop, met with any family, met with anybody. So clearly the tracer was pointing away from a workplace exposure and toward a social exposure, which is just absurd. I mean, my friend was working in the clean ICU, the COVID-free ICU without PPE because they weren't provided with it when she got sick. And she wasn't going out to coffee shops or socializing with family or anything like that. We've all been very, very conscientious of protecting the public from potential exposures. And now clearly the hospitals have some responsibility, but they're trying to walk away from that. And that's why I came here today. That's why I want to offer you this testimony. We need, those of us in the front line need, we need our elected officials. We need you all to acknowledge and get the hospitals and the industry to acknowledge that if somebody gets sick, that if somebody works with COVID and becomes sick, they got that at work. They got it on something like a crowded shuttle bus or a unit where there wasn't enough PPE or where we were forced to reuse our PPE, not at Dunkin' Donuts. And this helps us immediately. This helps people access workers' compensation insurance. But passing occupational presumption will also offer some long-term protections, because we don't know what will happen 5 or 10 years from now. We have seen patients with severely damaged lungs, and we don't know what the health sequela of this will be. So permitting folks like us to access workers' comp now due in presumed based on occupational presumption will give us more certainty in the future. So I ask you today to pass the resolution. Frontline workers in the city, across the Commonwealth, across the country really need this. Thank you so much.
Thank you. I'm now going to go to Ellen MacInnis. Please, you now have the floor.
Thank you, Councilor Mejia. I have I have something to show you all. This is an N95 that I wore for 12 hours. Well, I took it off to have a bite to eat in the middle of the night, but it's almost 13 hours by the time I was done Monday night. So I can tell you that there were little rust marks next to the staples right there where I probably perspired. There's right down here in the corner is some sort of organic material that has turned brown over the past 48 hours. The shape of this this metal is now deformed, and the mask is uneven. If I wore this again, this would not give me the protection that I needed. And yet, had I followed the hospital's directive, I would have submitted this for a cleaning with some hydrogen peroxide, and up to 10 times I'd have to do that. And even after airing out, when you put a mask on after it's been cleaned with hydrogen peroxide, you get this sort of burning in your throat, my eyes water. It's just very unpleasant. I find it annoying that in a country where a Ford F-150 truck can, from beginning to end, takes about 20 hours to manufacture. So Ford can turn out something as complicated as an F-150 pickup truck in 20 hours. And yet we can't produce enough life-saving equipment for those of us who are taking care of COVID patients and suspected COVID patients. This is absurd. This is a disgrace. And here's the deal. I think this has happened because hospitals know we're going to take care of our patients, whether we have this equipment or not. There's none of us who are not going to go into a room and take care of a patient. We'll do the best we can. My boss told us a few weeks ago, if you have ponchos or raincoats, you ought to be ready to bring them in because we're going to run out of gowns. That was about 2 weeks before Stewart donated 50,000 gowns to the state, which don't tell me for 1 minute that wasn't a publicity stunt. And don't tell me for 1 minute that they didn't engineer some sort of a tax deduction so that they could do that. It is not in the hospitals, the employer's best interest to protect us because they know we're going to do the work anyway. I think what we need to do is hold these companies responsible. In the same city where we're being crammed on buses, where nursing assistants and people who care for our environment are being crammed on buses and not provided good PPE. You know, right 2 miles down the road from St. Elizabeth's, we have Partners Healthcare, which is providing PPE for everybody, and they are providing alternative housing and help with childcare, and they're not giving people a hard time about being paid when they're out sick. Everybody that I've worked with who's been out sick has had to use their own paid time off. And it just sticks in the craw to think that this company is accepting government bailouts and then pocketing some money in the meantime. And a lot of these hospitals are self-insured. So when you talk about workers' compensation, you're talking about the hospital's own money. So it's in their best interest, as previously, I think Jody mentioned this, it's in their best interest to get people off their the private payroll and onto public payroll, push people onto unemployment and onto SSDI and Medicare and Medicaid. The hospitals, the employers do not want to take responsibility for this. And this is I would say it's even more so in the for-profit sector of healthcare. I think what we need support from our elected officials. I know Liz is very, very familiar with this. We need support from our elected officials in our ongoing battle to make patients and those of us who are caring for patients safe. Thank you.
Thank you. I am going to ask Ellen for some remarks, if you want to answer that, address that.
Thank you, Chimahia. I know I have a lot to say here.
And I'm going to keep 2 minutes.
I understand that. So I just want to point out that yesterday, 8 COVID positive patients were admitted to the ICU at St. Elizabeth's. We are still seeing COVID positive patients. I believe we will begin to see that trend down. I would like to say we cannot underestimate the impact of this pandemic on those of us who provide support services for behavioral health patients. We have seen a tremendous surge in folks presenting to the emergency department for treatment of mental health issues and addiction issues. We need to find a way to get resources to these folks. We have highly acute people who have been stressed, who have suffered losses, who have not been compliant with their medications, either because they couldn't access them or they were too impacted in other areas of their life to do so. Patients who have not been seeing their therapists or their counselors. I think that this is a population that will require nearly as many resources as our physically ill COVID patients have. I think that this will be the silent pandemic. These are the folks that we won't see. As a healthcare provider in Boston, I'm grateful. We have a pretty good safety net. We have the best team. We have emergency departments. We have mass mental. We have a lot of resources for these people. I don't think it'll be enough. I think that on a good day, some folks are living very close to the edge. And when you throw something like this at them, they're just tremendously impacted. That being said, I think we need to go through with this, remembering that there is a world of there is a world of hurt out there. There are people who are really struggling. Thank you.
Thank you, Ellen. Thank you so much.